From 2009, which was our peak year of HIV numbers, down to 2014, our trend has continued to steadily decline in terms of new HIV diagnosis. And at the end of 2014, we reported 33 new cases. However, we haven't sat back and been satisfied that the work is done. HIV is a complex disease, and we've continued to look for cases in all areas, in all risk groups.
The general presumption based on the numbers that are generated by the Ministry of Health of the province shows that there's been a flattening or a decline in the city of Saskatoon HIV infection numbers. But I think you have to be closer to the ground to understand that that's just a calm before a storm. What we're finding is that people who are now showing up and being tested in our health center are people who have recently come to the city from rural Saskatchewan, where the anonymity and the ability to have harm reduction supplies, etc., is not as prevalent as it is, or as anonymous as it will be here in a larger city. You're pushing almost 10% rates of HIV infections in a population. You're at epidemic levels. So anybody who's kind of sitting back and saying, oh yeah, it's all under control, you don't have a really good sense and a really good picture. So no, we're not sitting back in any way, shape, or form. As a matter of fact, we're pushing forward fairly aggressively to deal with getting people not only tested and connected to care in the city, but actually carrying that out into rural Saskatchewan through mobile outreach and activities that we can do in those communities as well.
The constant messaging is it's not a death sentence anymore. It's not a death sentence, and your health is your responsibility, and we know that you don't want to make anybody else sick, and so let's help you keep yourself safe and healthy and the people around you that you love. So that's the messaging.